Ladies and gentlemen, we have two very special guests tonight, Dr. Paul Cottrell and Leah Schaefer from the Oppenheimer Ranch Project will be joining us on the ultimate update on the coronavirus outbreak. Now, Dr. Paul Cottrell's YouTube channel has been exploding because he is willing to talk freely about this topic with other YouTubers like myself, even Leak Project. That's where it all started. And Paul's a researcher in chaos theory and has an interest in modeling financial markets. It's where his PhD comes from, which is very important in these times, and we'll get to that eventually. But first, we're going to talk about the explosive nature of the virus, the fact that it may have been engineered, and some of the science around that, and check out, and we're going to discuss Paul Cottrell's books probably later in the podcast, and the fact that he's prolifically been posting about all his thoughts and theories on the virus. Now, before we introduce our guests, I'm going to show you a quick map of where we currently know from official sources, the Wuhan virus has broken out. And this new coronavirus, as of 8 hours ago, has been declared a global emergency by the World Health Organization as the outbreak continues to spread outside of China. The main reason for declaring this a world health emergency is not because of the tens of thousands or hundreds of thousands infected in China. It's the fact that it's spreading worldwide, according to the World Health Organization chief, Tedros Adhanom Ghebreyesus. Now, the concern is that this could spread unabated in countries that don't have the types of quarantines that major first world countries have. And we already see person-to-person spreading happening. This was confirmed today now in 8 countries worldwide. The official numbers show 213 dead, almost 10,000 infected. These are extremely deflated, and we know this. And there's even bigger problems. Not only is there person-to-person transmission, but protective devices like masks are being bought out of supply chains, and people can't even get protective gear. As of 9:20 a.m. GMT, Italy discovered its first coronavirus case, and we now have 8 countries with person-to-person contact. Paul, thank you for coming on the show. Welcome, Leah. How the heck are you guys?
I'm great, thank you.
Good, but kind of concerned.
All right, so Paul, let's start with you, and let's just go through the headlines. And I have lots of headlines up here, and I'm just going to tick them through as we go. So at 9:20 GMT, Italy discovered its first coronavirus case, we have dozens of countries worldwide with this virus, just a few cases in each country, thankfully. But there are tens of thousands in China now, and people are buying up masks. And what do you think about the tracking numbers before we get into the science and the reporting currently?
Well, I think that the numbers are actually deflated. There's a few reasons. One is probably the regime in China is deflating the numbers to reduce fear in the population and maybe worldwide. I think this was a leaked virus out of a weapons lab, probably by accident. I don't think it was forcefully leaked. But I believe, and I have published reasons why I believe this, it's a bioengineered virus for probably studying vaccinations. So it makes more sense to make it more virulent in the lab, try to create a vaccination for it, and in the zoonotic world, where the virus normally, that virus that maybe they were going to come up with in the lab, it would respond to a lower grade. But it does seem at the genomic level and some other anecdotal evidence that's going on with this outbreak that this virus was bioengineered. Now, I think the numbers are deflated probably by a factor of 10. So that would mean that, we're at about 90,000 cases and quite a few deaths, around 2,000 deaths.
Now, Paul, let me jump in here and let's get Leah on. Leah, what do you think about the numbers? And what I'm showing now is David Dubine sent me in some of this statistical analysis coming directly from China, where he is. And it is showing that as of January 29th, yesterday, 10,000 cases reported, 150 deaths. And based on these numbers, if you look at his projection, by 15 February, there is 12 million predicted infected and 401,000 deaths with a 3.25% death rate. Now, Leah, if you can see this screen share, which you probably can you tell us what you think about the current numbers?
Yeah.
And what you think about the fact that maybe this virus is manufactured?
Well, I think it's a pretty good guess that these numbers are severely deflated. The thing I keep asking myself is why they're so deflated. Now, earlier on, which wasn't very long ago, it made sense to me to deflate the numbers to eliminate panic. But I'm thinking about David Dubine's message that he sent about the state of things in China right now. And I just don't see at this juncture how it's all that helpful to deflate the numbers to eliminate public panic, except that I can only guess that it's a political measure. I mean, this logarithmic curve here looks right for a virus. I don't know if everything is just scaled down, as Paul suggested, by a factor of 10, and that's probably pretty accurate. But I don't know. I guess this is also to prevent panic in the markets and the rest of the world. And maybe there's some hope that this can just be contained in Asia for the most part. I don't know how likely that is, but this is a weird situation, and it is frustrating to not know if we're getting the right information.
Well, I think it is, Leah, if I may interject, being contained in first world countries correctly, which is why we don't see a big spread outside of China. But I think that there was a latent delay, if I may bring up the latency term, because we're about to get into that, Paul. And the reason I want to get into that is because of your ideas. So I did a little research on the coronavirus, and based on what you and I have talked about, the latency is the key to this virus spreading. And the latency has to do with the RNA replication inside the mitochondria, inside the cell. But more importantly, the virility, the viral nature, like the flu, which kills tens of thousands annually in countries worldwide. The flu is actually transmissible before there are symptoms visible. And this is called the latency phase. And according to what you have brought to our attention and that we have up here on the screen now, back as early as 2005, severe acute respiratory syndrome, coronavirus-like virus in Chinese horseshoe bats was being studied by Laksu, Wupik, and others, up to a dozen scientists that were reverse engineering this virus to learn more about latency. So what can you tell us about that, Paul?
Well, researchers in Canada and in the Wuhan facility, weapons facility, were designing bat SARS viruses and building up a more virulent strand so they can test them for vaccinations. The idea is that you make a strand that is much more virulent in the lab, and you're able to speed up the research in the petri dish to try to find something that would be usable against zoonotic strands of coronavirus. On top of it, there was research done about 3-4 years ago by Peng Zhu, and he focused on the open reading frame of the 3B protein the reading frame 3B is a gene that codes for a protein, and that protein helps assemble the capsid of the virus. So they were designing bat SARS strands and studying the delay mechanism for the capsid assembly. So when you look at it from kind of the bioengineering perspective, they designed a virus so that would have this longer period of latency or infection, and we're seeing this in the epidemiological numbers where people are saying, it's not a 3-day or 4 or 5 day window, and then you start infecting. It's actually a 14-day window. It may be even more, because there is word out that the first case that actually had clinical signs were either December 1st or December 8th, depending on the news story that you look at. But there are cases that are trickling out of China and that are trickling out of China they're basically stating that this virus probably was leaked out and started infecting people late October or even early November.
Let me jump in here, Paul.
Yeah.
Yeah. So what we have on the screen now is a paper that just came out today on genomic characterization and epidemiology of the 2019 novel coronavirus, the coronavirus that we are now seeing spreading, and the implications for its origins. So what you've just revealed to the public is that studies as early as 2005 began on the bat SARS coronavirus, and they were studying into the latency of it. And now we have a version of this virus with extreme latency. And a paper coming out today is explaining that there was a mutation jump in this virus that is atypical, which means it's not normal. So there was a huge mutation jump, which was either biologically engineered, or this virus has begun the mutation stepping period, which I think Leah knows something about on the Spanish flu. So Leah, what are your thoughts on this paper coming out today?
Well, okay, so like as an example, the Spanish flu, really started to spread in January of 1918, and in August of 1918, there was a mutation that made it much more virulent. I honestly don't know a ton about this. I'm no way a microbiologist or any such thing, but I do have the distinct impression that when you have a virulent virus that is spreading through a large population, the chances of it mutating are pretty good. And that's simply because you're going through a huge pool of of genes. You have all of these genes to play with. So that can actually be a good thing, right? A virus can mutate and become less virulent, or it can mutate and become more virulent. But, I also wanted to point out that it's not just the latency of this virus. We're talking anywhere from 2 to 14 days before symptoms onset. But we're also not seeing reported a lot of recoveries from this, which means that people are staying sick for a long time. So it's not just that 14 days where they're asymptomatic and you don't know that you need to stay away from this person, but then you have weeks of illness where you're potentially symptomatic, and that's a very long time. So even if the mortality rate stays kind of low, like let's say it stays around 3%, and let's say that the R0 transmission rate stays at about, what am I seeing lately, 2.6, or anywhere from 2.4 to 2.4 to 3 point something or other I saw on GMA News in a conference out of China from the health minister. Even if those numbers stay where they are, if people are going to be this sick for this long, then this very well may continue to spread the way it's spreading now at the same rate. So it's kind of scary.
Well, I did see some good news on the recovery rate, thankfully, and I was just looking for it. I really can't find it right now, but the recovery rate is quite good. on healthy people, and it appears to be that this is really only very dangerous with people with pre-existing conditions, especially respiratory. So, and that was coming from a video that I just recently watched. Now, Dr. Paul, let's continue with the latency idea. And the World Health Organization is warning that we must take action. What does that mean in your eyes?
Well, I think I think that the health organization, the CDC and the NIH and some other organizations are now waking up to the potentiality of seeing a outbreak happening in developed nations. Hopefully it doesn't happen. I think there have been measures taken that have been serious mistakes. For example, I think they should have shut down all air travel right away. And there was a mistake made in China early in or late December, early January, where they kind of told the public, you know what, this is not that much of this is not a high risk situation. And they had festivals, and they had this 1,000 person dinner that was in the province that Wuhan's in, where people are kind of sharing plates, and it's kind of like a buffet kind of situation. So, there's many levels of incompetency on the Chinese side on how they handled it. But I think there is also at the WHO level incompetency, because I think that the numbers, even the published numbers, when compared with swine flu, was showing more deaths and a faster derivative. So I really believe that the World Health Organization is not really stepping up to the plate and having a real plan in place on what they're going to do when there's an outbreak in a developed nation. Because I think that they're trying to call markets. They don't want to make people feared in the market. But what the reality is that it's going to get out. People are going to start getting sick, and especially in Chicago. We're probably going to see an outbreak in Chicago, and we're going to start seeing it spread. So they're just laying the groundwork to prime the public to accept the fact that there's a high potentiality of an outbreak. I hope it doesn't happen, but if there is an outbreak, we're going to start seeing huge numbers. And whatever that latency is, if it's 14 days, 1 month, there are waves that take place. We could have this, we're seeing the first wave, but the second wave could be much worse, or it can be attenuated. We don't know. But I believe that the CDC and the WHO are definitely behind the 8 ball on this.
Yeah, and Paul, it's my personal opinion that they dropped the ball on this one. And if we look at the numbers coming directly from China, from David Dubine, and if I can quote him, which I can't because I can't bring that up, but Leah read what he sent to me, and he sent to Rex Baer just about 6 or 8 hours ago. It was like, kiss your loved ones, pray for the best, because it is coming. And based on this, the graph that I'm now showing, which is looking exponential, and if they are underreporting, it doesn't matter, because the numbers that we predicted yesterday and the day before, 48 hours ago, we talked, Paul, were spot on, and this will continue, which means by February 15th, there will be 12 million infected and almost 500,000 deaths. Leah, what are your thoughts on these graphs at this point?
Well, I mean, I personally think that by the end of this month, we're going to be at 100,000 cases. All right. And, have the 3 or 5% death rate. By the end of February, we'll be at 1.6 million with a, 3 to 5% death rate. But, so that's kind of the projection I have. So by the beginning of April, maybe 25.6 million cases worldwide. But it's highly predicated on the outbreak in developed nations.
I was I was kind of laughing earlier today about the World Health Organization. They're definitely behind the 8 ball. So this kind of made my eyes go screwy. When they declared that this is now a global health emergency, one of the media lines that I read was that this will trigger tighter containment and information sharing guidelines. However, they're not recommending further travel restrictions, which just kind of makes me scratch my head and go, what? And it does kind of raise the question about, what happens with the human factor here? What happens when somebody escapes quarantine? Because there will be somebody who does that. Here's sort of an interesting example. I think Japan is going to have a problem soon. There were 2 Japanese people who were evacuated from China, and they refused to be tested. And the government said, well, okay, I mean, we don't have a legal basis to force them to get tested. But we will do our utmost, I'm quoting now, to protect lives and the health of the people, and we will make decisions without hesitation. The other interesting thing about Japan there is that they have a special law which designates the Wuhan virus as a designated infectious disease, and it allows authorities to make hospitalization of confirmed cases compulsory. And apparently there's a number of people in Japan that are angry that those 2 people who were evacuated from China won't be tested because they refuse. So those folks feel that, in the interest of the public good, that they absolutely should be tested. And also in Japan, you've got there was the bus driver. Their first case was a bus driver who was on a tour group in China. And then a tour guide who was working with him now also has it. So I'm thinking about these 2 people who were on this tour guide and probably in contact with a lot of people. And I would guess anything that Japan has 11 cases confirmed today. I think that number is going to go up pretty quickly. So I think Japan will be an interesting test case to see what happens if Japan starts getting more stringent about testing people and making them go to hospital and maybe putting people under quarantine, and seeing how people react to that is going to be pretty interesting.
Yeah, well,
because the great irony in all of this.
Go ahead.
The great irony in all of this, right, is that we're suggesting that potentially this virus was released on purpose to help bring in a new world order, which of course will involve quarantines and maybe FEMA camps and who knows what. But in reality, quarantines to stop something like this is really what has to happen. So it's anyone's guess how people will react, but how people will react will determine a lot about how this goes forward.
Yeah, and my whole point was simply this, that the whole methodology that the Chinese government was using to implement a quarantine or whatever's happening now at the borders or a shutdown is they were measuring the temperature of the forehead of people, their citizens, which has nothing to do with this virus currently. If there is a latency that's even 1 day, and we're suggesting a latency of 3-5 days, Dr. Paul, I want you to get in on this. If there is a latency, unheard of, longer than the flu virus, we have a new outbreak of a pandemic unlike anyone has ever seen. And if it is biologically derived, and there will be studies happening right now, I guarantee, by the CIA and other groups. They're going to determine if this is a biological entity. Maybe they created it. Who knows? But the point is that this will spark wars. So, Dr. Paul, talk about the latency and how stupid that the forehead testing of temperatures, that's not going to protect the outbreak. The outbreak is happening now.
Right, exactly. And this proves the point that I was making about the WHO and the CDC. They don't really understand what they're dealing with. And I don't really believe that they're looking at just the literature like we are, in the sense that what were the researchers at Wuhan publishing? You know, for example, Dr. Zhou that was, dealing with this open reading frame 3B capsid in bat SARS, also manipulated bat SARS. And this is really important when it comes to the latency issue. It was manipulating bat SARS, and he published a paper dealing called the immunity of the spikes glycoprotein of bat SARS-like coronavirus. So what they were doing was they were mutating or adjusting the S protein, the spike glycoprotein. This is the S protein that actually attaches to the receptors in the cell that allows the virus to come into the cell, to infect the cell. And by monkeying around with this S protein, I believe they were able to design the virus to go under the radar of the immune system. And there is a data point to prove this, because a lot of the individuals that are getting this infection have lower white blood cell counts. So this is a very important point, that it's not eliciting an immune response like it should, compared to, let's say, other SARS or MERS-like infections. And some of the clinical cases that are coming out of China, per a news network in Taiwan, are saying that there is fibrotic tissue in the lung where there's this permanent scar from these advanced cases of pneumonia. Not only that, it's messing around with blood pressures in the lung. When you infect that tissue, you're affecting what is called the renin angiotensin aldosterone pathway. In a basic way to look at that is that when your blood volume or blood pressure is too low, what will happen is that your kidneys will signal renin, and that will signal a pathway in your lung to activate angiotensin 1. Angiotensin 2 is then activated in your adrenal gland, in the cortex of the adrenal gland, which will produce aldosterone. That will lower your blood volume to lower your blood pressure, or higher your blood pressure, by bringing more sodium into your blood and more water into your blood. Water follows sodium. So sodium's come back into your bloodstream, water's coming back into your bloodstream and raising your blood volume. People are passing out. We see these videos that people are passing out because their renin angiotensin aldosterone pathway is inhibited through the scarring that's happening. The functioning of homeostasis we're starting to see is at risk here. So this is part of the reason why we're starting to see kidney dysfunction. We're starting to see, breathing problems because of the pneumonia and the permanent scarring of the fibrosis, this white blood cells can't fight the infection, so you continue to have this blood pressure issue,
So if
this low blood pressure issue, and then passing out.
Homeostasis. Cannabis is the number one cure to bring homeostasis back into full effect. What would you think about cannabis as a cure for the virus?
Well, I mean, there's different levels of homeostasis. There's, cognitive homeostasis. There's blood volume homeostasis. But I think a lot of the research when it comes to homeostasis is more like Parkinson's disease, where, to reduce the shakings. There's a lot of evidence on that. I haven't heard of any evidence of DMT or other derivatives that would lower blood volume or increase blood volume. I don't know. I do know that disinfection is designed to be long-term and latent because they wanted that in the lab to be able to study why in the zoonotic environment do these MERS, SARS-like viruses have a long duration in a host without showing any symptoms. So we know that they were doing that in the lab through the papers that are published. Looking at the genomic code, we know that they were monkeying around with the S protein and the replicase.
So Leah, what do you think?
And we have clinical evidence. We have clinical evidence that this long-term latency we're probably going to see a breakout, in probably 2 to 3 or 4 weeks.
Well, yeah, we have a 10 to 14 day latency period. We know about that. Leah, I want to know what your thoughts about this virus potentially being leaked on purpose. And I'm going to suggest, this is my thoughts, that it is our own government that has manufactured a fake leak nearby a Wuhan factory that is actually working on this virus. Let's call it a false flag. Leah, what are your thoughts?
I don't know. This is a hard question to answer. I have been kind of sitting in the middle on this one. I've been thinking that this was actually an accident, that it was leaked and it wasn't on purpose. But I'm sitting there because I'm reserving my judgment. But I want to address something kind of related to this. I keep seeing these little things around online where people are talking about how they think that, practically every pandemic was created on purpose by the powers that be. And I'll just address this in terms of the Spanish flu. Pandemics happen, and it is a natural phenomenon. They definitely happen on their own. I've seen some people claiming that the Spanish flu was a pandemic created by distributing vaccines or something, but this is just not even possible. When Spanish flu came out, we were still in the infancy of learning how to produce vaccines, and we had made a lot of progress at that point, but it definitely wasn't a solid science. And not only that, but influenza in general was not even isolated or identified until the 1930s. And Spanish flu started in 1918, and we had some of the first commercial vaccines for influenza in the 1940s. In 1918, there were some attempts to create a vaccine for the flu. However, it was not understood that the Spanish flu was viral. It was not understood that the Spanish flu was viral as opposed to bacterial. And so all of the vaccines that were tried were bacterial vaccines. So, of course, none of them worked. That was a natural occurrence. It was not a man-made phenomenon. We are overdue for a pandemic, and we're seriously overdue for a pandemic in this world. So it's really, knowing that, it's really hard to say that this is on purpose. And the other reason I feel like it's hard to say that it's on purpose is that the outfall of this, the economic toll The toll on governments, the toll on populations as a whole is so huge. If the motivation here could really only be population control and some manipulation of the markets, but the collateral damage is so big. If this is on purpose for some specific motivation, it's a terrible plan. It might be on purpose. I don't know. I'm really reserving my judgment on this one because it's a little hard to wrap my head around this purposely.
Yeah, I think it's the perfect plan because the other plan that they had rolling out was not working. Globalism wasn't working through climate change.
Well, there's that.
Yeah, so that this is a way they can actually manipulate the markets and keep control as cities get shut down. Paul, what do you think about this globalist control narrative?
Well, just to cite, Tim Trevan was interviewed by Simone. She has a channel on YouTube called Zooming In. It's actually a pretty good channel dealing with China-related topics, all right? And he is a biosafety expert. And according to him, he said that that particular facility is known to have leaked accidentally different SARS strands. So there's a history of accidental leakage. So there's probably protocol issues with that facility. But there's a bigger point here. There is a lot of civil unrest in China because of this dictatorial regime from President Xi. Right, he rewrote the constitution. He's a forever kind of emperor, kind of right. So there is a faction. There is a fissure that's being created within the one party system, the communist system, the CCP, where there's a pro-Xi and an anti-Xi component here, and it wouldn't surprise me that this virus could have been leaked out to create turmoil within China to show the incompetency of the regime and to have a civil unrest. Now, what's interesting, and this kind of is like maybe a little conspiratorial, but there is a plan that was made in 2008 by the Communist Party called the 1,000 Talent Plan. And that was to recruit individuals around developed nations that had important technologies. One of those technologies were bio and nanotechnologies. Another technology was the special chips, like very small, high-performing IT-related chips. All right. Now, the big point here is that just recently we have heard in the news, which I don't believe is a coincidence, that there are researchers and professors associated with dealing with China and transferring technologies from Harvard and from Boston University and having those technologies transferred over to China, on top of knowing that there were researchers stealing material, biological material out of Canada. So they're instituting that 1,000 talent plan to try to steal technologies. Now, do you think that the United States and the Five Eyes, maybe people don't know the Five Eyes, but the Five Eyes are the U.S., the UK, Canada, New Zealand, and Australia. But I believe that the Five Eyes are using this as an opportunity. I don't believe that the Five Eyes leaked it, but they're using it as an opportunity to leverage, to put pressure on Xi that if he doesn't follow kind of the Washington consensus and to not check us in the Asian Pacific, because the United States basically, freely roams in the Asian Pacific, and it's been like that since World War II, to make sure that shipping lanes are not a problem. I believe that the Five Eyes and the CIA and MI6 and these other types of organizations are leveraging this situation in Hong Kong, in Taiwan, and possibly even at ground zero at Wuhan, whereby they are trying to promote that civil unrest and use that as a wedge to bring down the Xi regime, or at least to bow down to the Washington Consensus. Now, will that work or will it not? I'm not sure. But there is a battle going on between the CCP and the Washington Consensus dealing with island chain movements, the first island chain, the second island chain, and the third island chains. And what's interesting is that China has leveraged the Solomon Islands and an island that is called, I think it's Kakabuta, but that island, those islands are moving more towards the Chinese consensus and not aligning with the Taiwan Washington consensus. So there's a geopolitical dynamic here. I think, but the specific issue on the virus being leaked probably was accidental because of historical situations with SARS. But I believe that the CIA is leveraging this issue to bring down Xi, because just look at what happened with Hong Kong during the protests. All of a sudden, they had gas masks and some weapons and American flags. Where did they get those American flags?
Yeah.
So it almost seems like that just like the terrorists happen to have all brand new Toyotas, in the Middle East, in Syria. Something is a little fishy here, but. I do believe that there is some leveraging going on between the United States and what's going on with Xi internal struggle.
Yeah, so let's get this clear. The probability is very high that this is an event that's being latched onto as an opportunity to push the globalism that they've been so suckling at the teat for years, and so but unfortunately, the cost of this opportunity is human lives. And based on the data that we're seeing, human lives, many are going to be lost. But people don't have funerals for the flu virus every year, where 60,000 people in the U.S. die. So it could be a similar event. But there is also misinformation. And you, in fact, sent me this article yesterday, which Leah and I both looked at and critiqued. There is misinformation on the web that is bad information. So if you want to believe that China is going to admit that the coronavirus was a bioweapon, that will never happen. Trust me, because that will spark a world war. But if you want to believe what we're saying here based on statistical analysis, that in 14 days, things will be looking very bleak across the world, we're probably in the higher probability there. And if the globalists, the cabal that will take control of this narrative, have anything to do with it, they will control the borders, they will control the markets, and they will control the narrative of this moving forward. So, final words. Leah, you first. What do you think about what I just said?
Well, I am glad that you mentioned that, this may be being latched onto because all of the other attempts at globalism have failed. I did get an instinctual feeling about that myself a couple of days ago, and I think that that's quite likely to be true. The thing right now, as things stand at this moment, we've got 65 million people in China quarantined. As we've discussed before, most people do not have 5 weeks of food stored up. So what I want to know is what happens when those people run out of food, because as things stand right now, no one's going anywhere. This quarantine is not going to be lifted. So even if this virus, slows, it's going to be a while. And we're already in a situation where we're looking at a lot of people being stuck without food and a tremendous amount of civil strife. And that's going to be very ugly. And to be quite honest with you, when I think about this, my heart, I start to tear up a little bit, because this is a huge toll on human life. And it is very, very sad. So I'm really concerned about what that picture looks like coming up soon, because I don't think that that's escapable at this point. I did see earlier today, there's a Chinese respiratory expert, Zhong Nanshan, who said that we should expect a peak in 10 days, and then there will be no large-scale increases. I just don't see how that's possible here. Right. With almost 10,000 cases that have been diagnosed. That doesn't make any sense to me. The other thing that I keep hearing over and over and over again in the media is we talk about the R naught number, which we don't exactly know what it is yet, but then immediately afterwards they always compare it to the R naught of measles, which is the most contagious disease in the world. R naught for measles is 12 to 18. And I just heard the Chinese health minister said this the other day, and it's like, okay, we know that, and we're not dealing with measles here, but nonetheless, this is still extremely contagious. It still is a global health emergency, and we're looking at a very serious situation. Maybe the virus will peter out. That would be wonderful, but we have all of these people quarantined, and what happens to them in the next, after the next 2 weeks, let's say. So that's what I'm concerned about.
Yeah, we're praying for the people that are quarantined. More importantly, the underreported numbers, 10,000 infected in China, probably more like 200,000 at this point. Dr. Paul, what are your final words on where we're at? And we'll continue the conversation in a few days as is deemed necessary.
Well, I'm concerned about the potential outbreaks that we're going to see in the United States and in Europe, because if that does happen, which I think it will, we're going to start seeing a lot of people panicking. And because they're not prepared, there is going to be some serious unrest and pressure on the political establishment. Their representatives in Congress, there's going to be pressure there for answers and help. And a lot of people are going to be panicking, and there's going to be probably civil unrest. And we're seeing that in China. There's civil unrest going on. They're just not being just quiet. There's some uprisings that are and complaining that's going on. I'm very concerned about this lower immune system effects of the virus. This low white blood cell count scares me. It scared me just knowing that there's a potential pandemic that's going to create a deep scar in people's lungs for a very long time, if not for the rest of their life. And so we're going to start seeing, once this all goes away, once this all burns out, we're probably going to start seeing emphysemas and COPD and more severe asthmas months and years down the road on this, because of this fibrosis that takes place in the lungs. So it's not just the virus and its effects economically and socially, but the long-term effects. And not only that, think about all the nurses out there. They're the front line on this, not the doctors. The nurses are the really ones that are caring for the patients. And my heart goes out to them, because there's not enough nurses, and they're overworked and underpaid, and they are going to get burned out. And we're going to start realizing that there's cracks in our medical system that need to be addressed.
Well, let's all think about boosting our immune system moving forward. There are ways to do that. You can start now. You can start eating high nutrient-dense foods, organically produced. You can start adding micronutrients to your diet. Even look into Rick Simpson oil, because pure cannabis extract is a cure-all for almost all of the respiratory diseases that this infection causes. I want to thank all of our guests. As the coronavirus debacle unravels before our very lives, check out Paul Cottrell's site. Subscribe to his channel. Check out all his videos. He's been very prolific. He's talking about death curves and Taiwanese news in English. He's talking about maybe, more importantly, the facts that the coronavirus has been studied since 2005. They've been studying this latency, and maybe, just maybe, one of these biological entities escaped in Wuhan, which has happened before, and we're suffering the consequences. And the consequences of this virus are very bad. Any words of wisdom from each of you as we close out? Leah, you first.
I just keep thinking about David Dubine's message, and one of his sentences was, "Asia has fallen." And that to me seems to be a very big warning. And I urge people not to panic, but to get prepared and not scared. We have some time before this may reach us in a way that is infectious in the United States. So I encourage people to work on their immune systems and get healthy, and try to remove yourself from heavily populated areas if you can, and think ahead a little bit, because this could get ugly worldwide, and I really hope it does not. And just want to also say that my heart is really going out to people who are struggling in the middle of this.
Yeah, and I agree. If you're stuck in China, we're praying for you. Be safe. Masks are being bought out. So if this is a worldwide outbreak, be kind, be prepared, not scared, do the right thing. And we're going to have anti-Semitism picking up. There's just going to be people that are angry at Asians in general because they're that stupid. And I know that you are a scholar and one of deep wisdom, Paul. Can you give us some guidance moving forward? And we're going to get back to this podcast in just a few days as this is unraveling, folks. So stay tuned. Dr. Paul, we're going to give you the last words.
Well, in terms of maybe preparing nutraceutically, I would recommend, because of what I've been researching about the lung tissue issue with this virus, I think that a potential healing effect, or at least to mitigate the scarring, would be like a turmeric type nutraceutical, and that C60. I don't think the brand matters, but a C60, because I think all this inflammation that's going to be taking place during this cold season, you want to reduce those free radicals. There's going to be a lot of cellular damage, and your mitochondria are going to be taxed on fighting this disease, all right, or just the flu season. During this flu season. So I think, maybe, getting stocked up on turmeric and C60 could maybe boost up your immune system and reduce those free radicals that when you do get hit by the virus or just the normal, flu season, because people are going to start getting the flu and they're going to assume that it's coronavirus. Hopefully that boosts up the immune system. But in terms of just social unrest and stuff, the xenophobia is definitely starting. I mean, I live in New York, and I had to go to another location in Queens to have that Taiwanese video that I uploaded translated. I had it translated in real time. I was filming the actual Taiwanese news, and I have a friend that's Taiwanese that was translating in totally real time and then posted it immediately. And then I got a copyright infringement thing, so maybe they'll pull it down. So please, whoever's watching it, whoever's watching it, but it was filmed on my camera. It wasn't like I pasted, I mean, I filmed a film, so how could that be infringement? It's my film. But the point is that it was real time translated by someone I know that is Taiwanese. And so please go see the video, download it, because I'm sure because there's many things in there that is proving some of the points that we've made on this show. And just save it on your hard drive or whatever, because they'll probably pull it down, but it's there for however long it is. But there's going to be xenophobia. And as I was walking to the station, the Wall Street, through Wall Street, there's always a sea of Asians looking at Wall Street, the Wall Street area, and Federal Hall, which is where the Washington statue is. The Asians are always taking pictures with Washington, and almost every single person in that group, that travel group, had masks on. And this is New York, and we haven't had any cases confirmed yet. And there's an awful lot of people that are. That's why I'm saying that I am concerned about an outbreak. It's going to happen. I can't tell you exactly the date, but it's going to happen relatively soon, because we did not prepare. We don't have a CDC or NIH in the United States that is prepared and telling the public what is the plan if an outbreak happens.
Hey, Paul.
Because if they did that, then the people would not be so afraid of the government.
Yeah, but
right now they don't want to do that.
How is there is no way to prepare for a pandemic with a virus that has a latency period of
No, but I get that point. I get that your point, Diamond. Yeah. But the thing that I'm saying is that someone, especially in a large city like New York, they could go on air, talk on CNN and these networks, and say, if an outbreak happens and it is this size, this is what we're going to do. And if the outbreak is this size, this is what we're going to do. Yeah. So I don't understand why they don't. I don't understand why they. Right, because if they do, people will start opening their eyes and saying, you know what? Now we have this surveillance state, and now we have this lockdown state, and now we have these kind of like almost like a new twist on a FEMA camp, right? So it's concerning. It's really concerning. I just feel like there's a lot of incompetence at the government level, and once the fear starts, some of the conspiratorial theories start to come to fruition, unfortunately. So I am concerned
about this. Something else about this too. Let's say the United States population does not have any experience. The current U.S. population has no experience with virus outbreaks. People in Asia do have experience with this. So I'm really concerned about the panic in the U.S. as well as conspiracy ideas that don't make sense, or I've seen some ideas floating around about what people think can cure this, and then there will always be somebody that thinks that let's say there's a quarantine in place, there will always be somebody who thinks that it shouldn't apply to them and escape the quarantine, which can create a whole big problem in and of itself. So not only do we not have authorities here who are used to dealing with this, but we don't have a population that knows how to deal with this either. I mean, I don't think anyone really does, but I think a certain amount of experience with an outbreak and knowing how to be careful and trying to take care of yourself could go a really long way, and we just don't have that here.
Yeah, I agree with you. And I think that if there was some bi-directional communication between the populace and the government to come to some sort of middle ground, that the society knows what to expect when the government starts to institute a lockdown. If it does happen, people are going to really start freaking out because they don't know what the plan is. But when people do know what the plan is, then they don't freak out so much.
No, they don't. No, they don't, Paul. They don't. And let me end the podcast on this.
I'm trying to be an optimist.
Let me end the podcast on this. The population consists, and I'm going to go back to 1988 when I'm sitting with my professor at Temple University, my mentor, Peter Goodwin, and he told me, because I was disillusioned. He said, look, 80% of the population will never get it, never. And I might be generous, and the rest will. So we're looking at 20% of the population that could be with us, that is thinking correctly, and that is preparing appropriately. Okay? So proper prior preparation prevents piss poor performance. That's what we say here. You need food on hand. You need a year of dry goods, just in case the grid goes down. But in this case, when you're locked down, to be safe, you need to be away from the population. You need to stop interacting with them. And I think that the one thing that the general population, the sheep, and I'm speaking to you now, is that the face masks that the people are wearing in China is not to protect from getting the virus. The face masks and the breathing masks do not prevent you getting the virus. It is now you can transmit it person to person through mucus. It's coming through your eyes, through touching. The masks originally for all viruses are used to prevent spreading it. So if you have it and no one knows you have it, you can't cough on them and you can't get them sick. Paul, am I correct? What are your thoughts?
Well, I mean, the human species is more animal than human. So yeah, I mean, you have to be. We have animalistic tendencies, especially when we're in a fear mode. So yeah, but unfortunately, there's a lot of people, especially individuals like myself, that are living in a metropolis that we can't just bug out. I mean, I haven't had a car because I live in Manhattan for 10, 11 years because I use mass transit. So I'm kind of dependent on this organism that we call the city, right? So, and it was much easier when I was living in Michigan, in just suburbia. But I agree with you guys. You got to be prepared. There's no room to put 1 year's supply of food, in a condo in New York. So some people can't prepare that far out. But that's the downside of living vertically instead of horizontally.
Yeah, I agree with you. Now let's talk about silver and its effectiveness on virulence. Do you think that the silver that most of the preppers have these days, in the fact that they're making silver solutions, could that potentially kill this virus?
I don't think it won't. I don't think it will kill the virus. But what it will do is, if you start to feel a little bit sick, those early symptoms, you have bacteria in your lungs already, but we're living with that bacteria. But when you get infected by a virus, it offsets that homeostasis microenvironment, and other bacteria start to grow, right? And you might get biofilms. Now, the silver is an antibiotic. So to kind of prevent those biofilms basically forming and creating a cystic fibrosis-like type situation in your lungs,
That's what I'm getting at.
that would help. That would help. But you can't use that all the time because it actually can be toxic. I use colloidal silver when I have like a normal cold, but I only use it for about 4 days straight. I use 1 or 2 drops, maybe twice a day for 4 or 5 days, and that's it. You cannot take that every day because you'll turn blue and die. But the thing is that people need to realize that we live with bacteria. We need bacteria. All right. There is actually communication, cellular chemical communications that are taking place that help with our metabolism with bacteria in our gut and all over in our body and in our lungs. So so right. So once you get infected by a serious situation like the coronavirus, then you're affecting that microenvironment. So colloidal silver will help fight against your infections, but some of those infections could be bacterial infections while you have the virus. But I do not believe one iota that colloidal silver will inactivate the virus.
Yeah, I'm with you on that.
Well, you mentioned.
Go ahead, Leah.
Something really important here. Just that with any infection, when your immune system is compromised because it's busy fighting off an infection, you can end up with other infections and other health problems. So while as individuals we're not able to treat this virus if we were to get it, but we certainly can keep ourselves in tip-top shape, perhaps with colloidal silver or C60 or turmeric. So all of those things just increase the chances that should you get this virus, that you can actually fight it off. Oh, and Paul, I was going to suggest to you that maybe you should get a storage space and stock up on food. That would be my suggestion to you. I mean, I prepped. When we were in Philadelphia, I prepped. I had a house in Philadelphia. I was in the city proper, but I pretty much filled my basement with canned goods. Now, obviously, I was not living in a condo, so that makes a big difference. But that's my thought for you, is get a storage space and stock up. Little storage spaces in little storage spaces, cost about $130 a month. Yeah. Mm-hmm. But I mean, I'm moving rapidly towards that thought process.
We get 8 by 8.
I'm with you on that.
10 by 10 space for half of that price, around $90. 8 by 10 by 10.
Well,
you could store literally 50 years of food for 50
that depends
people.
on where.
But you've heard these cases though that FEMA could come in and do eminent domain on your property. Can basically take your things because they classify you as a hoarder.
So that's why
who knows?
That's why we
we're prepared for that.
Yeah, we go for sprouting seeds. So you can have like 300 or 400 pounds of sprouting seeds in a single square foot, or 2 square feet, maybe 3 square feet. And that's enough food for 3 or 4 people to get through for a year just to live, if you start sprouting immediately and you know what you're doing. So all these techniques of preparedness require skills. It's not like you're going to learn how to light a fire immediately when the situation comes through. These are all things that we need to take in account now. And it might be too late for some people, especially those in China. But people in China are prepared. They're people. They're herbalists. They have ancient medicine, so they have an advantage here. But in the first world countries where people live foot to mouth, where they're working to simply live, in a scenario where there's 30 to 60 days where you can't move or go purchase products, you're not allowed to move around. It's a big wake-up call. We're going to have a huge population reduction if this gets out of hand. And I pray for all the people all around the world listening to this podcast now that feel left out of the way. We're praying for you. There are wild edibles. Dig up roots. Eat the roots. You're going to know how to survive if you want to. Let's close the podcast tonight with a positive and progressive message to the people listening. Pandemics have happened always, and those that are healthy enough, and even the healthiest people may succumb to this pandemic, but it's those people that are helping, the helpers, the people that want to get our species onto the next level, that will have the message to send forward, and preparedness is the key, because we're moving into a time that this is the pandemic that we're dealing with now is just the tippy touch of the iceberg. We're looking at grand solar minimums, solar outbursts in the coming years, and grid failure. Everyone should be prepared because the governments want to control you, and we're trying to prepare you for your own future to survive and thrive in the coming times. Dr. Paul, what are your thoughts?
Well, I like the idea of ending on a positive note, and we have to be prepared. I agree with you, but because of the things that are going on in the immediate, I just want to reach out to the ones that may be listening to this that are healthcare workers, and just thank them that their skills are very important to keeping us healthy and safe, especially in situations like this. And a special reach out to those nurses and other healthcare staff that are the front lines at the hospitals, that risking their lives and helping people.
Yes, indeed. And I'm choking up. Leah, do you have any closing words?
Yeah, I would like to recommend to people that they read Anita Bailey's book, Cold Times. That's a great book for prepping for any situation, in my opinion. And I echo, but it's a very good thought, Paul, that, we really do need to appreciate our healthcare workers, because being on the front lines of this has to be intensely stressful. But even when disaster strikes, the one thing that I've learned about humans is that while they may do really irrational, crazy things out of fear and panic, there is another part of human beings where, when disaster strikes, people really come together and support each other. And the times that I've seen that or experienced that in my life, it's really blown my mind that even in the face of the biggest adversity, humans do know how to be human, and treat each other with respect and help other people. Most people are compassionate on some level, and if they can, they will help. And so if you feel like you're one of those people, you're in a good place, you can keep yourself safe and you can help the people around you. Do it. Work cooperatively with the people around you, because that's how anyone is going to get through any of this.
Yeah, and your vision is appreciated by all the people listening, Leah, and we appreciate you coming on the podcast. Thank you, Leah Shaper and Dr. Paul Cottrell. Your words cannot be more appreciated from my end. And as we move through the coronavirus outbreak, it's important for you people to realize that there is lots of misinformation out there. The graph you're looking at now, you should really appreciate, because if this is what they're revealing to us, what it reveals to everyone listening and the people on this podcast, is that we are in very grave times. And it is important for you to prepare now rather than suffer later. There could be borders shut down. You could be prevented from moving around in the coming days, but it's going to take a week or two to unravel, and we're going to be covering this live. Paul, you're going to be coming on with us as it unravels, correct?
Yes, of course.
Yeah,
I'm here for the duration.
Excellent. So we're going to have an excellent running narrative as this goes on. And don't be scared. Be prepared. Now, there's simple ways to... Hello. We have a call coming in. Yeah, that's Top Knot's dad. I got to get to that. Be safe. We love all of you. Be safe.